Now, let's discuss one of the most important intervention in obstetrics, that is AMTSL, also known as the active management of third stage of labor. The third stage of labor begins after the delivery of the baby and ends with the delivery of the placenta. So, proper active management during this stage can reduce the risk of postpartum hemorrhage, which remains a major cause of maternal mortality worldwide. So, as we have discussed, that the third stage of labor begins after the delivery of the baby and ends with the delivery of the placenta. The delivery of the placenta can occur by Schultz method or the Duncan method, and there are certain signs of placental separation, which includes the gush of blood pervaginally, suprapubic bulge, lengthening of the cord, and it is apparent and permanent lengthening of the cord, and height of the uterus increases slightly due to collection of the blood behind the placenta. Surest sign is placenta felt at the vagina, and the second best sign is the lengthening of the cord. And because human placenta is deciduate, so it has to shed after delivery. Now, this delivery of the placenta can be through passive management or the active management. If passive management is done, then the duration is 10 to 15 minutes, and with active management, the duration reduced to 5 to 10 minutes, and the blood loss is also decreased. And if this duration is increased by more than 30 minutes, then this is due to retained placenta and can occur in prolonged third stage of labor. So, active management of third stage of is very important to prevent the postpartum hemorrhage. This AMTSL is given by new WHO recommendations, help to focus implementations, and it should be done in all females in labor, and it is the best method to prevent postpartum hemorrhage. Now, there are 4 components of AMTSL. This includes injecting uterotonics, and what uterotonics is given: oxytocin, either IV or IM 10 international unit is recommended uterotonic agent for the prevention of postpartum hemorrhage. Delayed cord clamping is done, and deliver the placenta by CCT, also known as controlled contraction method or the modified Brandt's induced technique. So, if skilled birth attendant is there, then controlled contraction should be done, and in settings where skilled birth attendants are not available, CCT is not recommended. And the fourth one is intermittent assessment of the uterine tone. Previously, it is the uterine massage, but now it is changed to intermittent assessment of the uterine tone. And because this uterine massage is not included in the prevention, now it is a part of treatment of postpartum hemorrhage. Now, coming to the first step in AMTSL, injection uterotonic, and how frequently it should be given. It should be given within 1 minute of the delivery of the baby or immediately after delivery of the anterior shoulder of the baby. The dose is 10 international unit, IM or IV. IV bolus is avoided because of risk of hypotension and cardiac arrest with oxytocin IV bolus. And oxytocin is a natural oxytocin is a nonapeptide, while synthetic oxytocin is a octapeptide. And mechanism of action is it can lead to calcium influx and releases PGF2 alpha from the decidua, and thus increases the uterine contractions and hence prevents the bleeding. Now, it brings about physiological contraction, and oxytocin, we all know that it can be used for induction as well as augmentation of labor, AMTSL, PPH, management as the first line drug, and milk ejection hormone is also oxytocin. Now, the second drug that can be tried is misoprostol. Misoprostol can also be tried, and the dose is 400 to 600 micrograms. Other uterotonics can be symptometrin, carbitocin, methyl ergometrin also. Now, the second step in active management of third stage of labor, it is delayed cord clamping. And what is delayed cord clamping? When the cord is clamped after 1 to 3 minutes of the delivery, so that 80 ml of the blood in the cord goes to the neonate, which can prevent neonatal anemia, and it is a part of Anemia Mukt Bharat program. So, delayed cord clamping can be done, and it should be avoided if the infant is preterm, COVID-19 patients, macrosomic babies, and postterm cases. Early cord clamping is done in case of birth asphyxia, neonatal resuscitation whenever required, heart disease in the baby, Rh negative female with indirect womb stress negative, and HIV positive females. Now, the third step is controlled contraction. What we do that we place one hand is placed on the abdomen of the patient, and the uterus is pushed upwards and backwards, while the other hand catches the umbilical cord, and gentle traction is given in the downward and forward direction so that placenta separates and placenta is removed. Now the fourth step is intermittent assessment of the uterine tone. So the uterine tone is assessed every 15 minutes for the initial 2 hours after delivery, and it should be done more frequently if there is risk or the occurrence of uterine atony is there. So this is the management of AMTSL, or the active management of the third stage of labor. So this is recommended by WHO. Uterotoning, delayed cord clamping, controlled cord traction, postpartum vigilance means uterine tone assessment. Oxytocin and quality and supply should be also checked. AMTSL has not changed. The name is still the same. Thank you.